Greetings, my name is Alan Dalkin. I am a faculty member at the University of Virginia and have been on the Self-Assessment Committee for the Endocrine Society for many years, and for the last few years have served as the chair of that committee. One of our main products is the ITE, or the in-training exam, and I wanted to take a few minutes to explain to you what you can do with these reports that we will generate at the completion of the examination, and how that may help you in terms of the training program that you run at your institution. Let me start off by explaining to you what I think the in-training exam and the results that one obtains from that can offer you as a program director and your program and the fellows within it. The in-training exam is intended to be used as an educational tool for assessing areas where your fellows might need strengthening in terms of their knowledge base. The in-training exam does not have the scope of the ABIM certifying examination. Our product is 60 questions in length and cannot cover the full range of topics in endocrinology, although we do think it provides a very strong assessment of one's knowledge base in the general field. It can be used as a knowledge assessment tool, although it has not been validated as a predictor of board pass rate. That is, there is no particular performance on the in-training exam above which one would say the potential for a fellow to pass the boards would be higher. Our product has not been out long enough, nor is it in-depth enough for one to correlate the in-training exam with the ABIM certifying exam. And we've also intended the in-training exam to be used as a tool for you to develop the training program curriculum. That is, with the results that we will cover, we will show you here. If you identify areas where your fellows are doing particularly poorly in an area, you probably should take that opportunity to emphasize that area in the educational efforts in the coming year. Whereas in topics where everybody seems to be scoring well and scoring properly, getting the correct answer on a question, you may say that that has been adequately covered in your curriculum and don't need to work on that any further. So let me provide an overview of the reports that we will provide to you as the program director at the end of the in-training examination. There are really three. First, there's an overall program director's report that we will provide, which will have the comparison of your program as well as the overall test takers. Second, there's a fellows report that will identify the performance of the specific fellows within your program. And finally, there's a detailed report of each of the questions in the in-training exam. It will provide you the STEM, the 5 distractors, and then the correct answer. Let us turn and look at the program director's report first. There's a couple of important parts to this report. On the top part, you'll see some information which we'll discuss a little bit further in the next slide regarding specific information as it pertains to your particular program. On the bottom, you'll see the information for each of your fellows in terms of their performance as well as the year of fellowship training. This is the information in the top half of the programmatic report. On the left, we show summative data for all test takers that took this exam in a particular calendar year. In this case, for the in-training exam for 2013. What you can see is that some 134 programs participated with 560 test takers in total. The average score on the examination was 59.43%, and then we've broken that score down into quartiles, the highest 75th, 50th, 25th percent, and then the lowest score shown here along the left. And you can use this as a reference guide for how your fellows and how your program performed. Remember that while this seems like a large number of test takers, the statistics on this are not so certain that one could say we can translate this information in terms of prediction on how someone would do on an alternative exam such as the board exam. The results for your particular program are then shown in the next column. In this case, there were 5 fellows that took the exam, the average score of 68%, with the range being 76% to 63%. And then we show comparison data for all the test takers broken down by years of training, first year, second year, and those beyond that. and the average score in terms of the mean percentile correct, as well as the highest and lowest scores. As I said earlier, each of the fellows within this particular program are then shown in the bottom of the slide, the bottom of the report. In this case, there were 5 fellows. The years of training are shown here, and their percent correct is shown in the far right column. Finally, in the area, we tried to provide for you some information about topics, results, and learning objectives. First, you'll see for each of the questions a general topic that is identified. Next, below that, we will provide for you the results for your particular fellows in terms of the number of fellows and the number of them that obtained the correct answer on the question. And finally, we'll provide for you each of the learning objectives for that particular question. Now let's turn and look at the report that will go to each of the fellows who took the exam. It has some similarities to that which we have looked at in terms of the program report. On the top are the data that relate to the performance on the examination in general, although the fellow's name, the number of correct responses that they had, and their overall score is shown at the top. Then below this, in the bottom, as we'll discuss, is a summary of the results by the topic area that we covered with the questions in the in-training examination. So here again, on the top half of the report would be shown the fellow's name, the number of correct responses, and their particular score as a percentile. Again, we'll display on a per year basis, that is the year of training, first, second, and third or beyond second year training, shown here on the right, or the total test taker score shown on the left, so that they can compare their performance to that of others in their year of training as well as overall on the examination. In the bottom, we break down their performance based on each of the categories of the questions, so that, for example, in this test there were 6 questions on adrenal disease, and this particular individual scored 2 of those correctly, or answered 2 of those questions correctly. And finally, this is a copy or a portion of what would be the detailed test report. Again, on the top of each question is the stem, the question shown here, the 5 distractors, and in bold is the correct answer. So in summary, I want to review for you the goals that we had with the in-training exam and with these reporting methods. First, it was our goal to provide outcome data that the program director can use to assess the program effectiveness in specific areas and to help guide future educational efforts. We also had a goal to identify areas of strengths and weaknesses for fellows that can use them as a guide as they prepare for the American Board of Internal Medicine certifying examination. I would add that the in-training examination is an integral component for the full ESAP product, which is much larger, and all the questions that are in the in-training exam are contained within the ESAP product, and one can find full discussions and references to direct further inquiry if you have the full ESAP product. We want to thank you for obtaining and using the in-training examination for your fellows, and look forward to hearing from you with any questions or suggestions as they might arise. Thank you.